something I used to say, and I've had to change it for myself. I used to say, well, I'm a descendant of a slave. I'm not. I'm a descendant of greatness. Black history did not start with slavery. It started far beyond that, and I reflect on that as I walk in this space.
To me, it's being resilient, being able to continue to push forward. That's
Absolutely.
what sticks out for me.
Yeah. Being Black to me is beautiful. It's powerful. For me, I wouldn't want to be anything else but Black. I think that it is a badge of honor, and I love the skin that I'm in.
I define being Black as a lived experience that has many commonalities across many differences, actually, be it food, music, dress, dance. Being Black is about a shared cultural experience as much as it is about our skin color, my skin color.
Yeah. To add on to that, I really resonate with the resiliency of that. Being Black to me is always setting a standard. It's the most popular. Every culture derives something from the Black experience, or it and tries to derive something from the Black experience. And you can see it seeped into every part of the fabric of like what goes on outside of Black culture. So it's not a popularity contest when you're the most popular.
To me, being Black is it's a feeling.
Yeah.
I think you feel that when you walk into a room. You can look at another Black person, just give each other a look. And both
Right.
have that universal respect, whether it's good or bad. Like,
Little side eye.
Yeah.
and I also just really resonate with you with this resilience. I think Black folks have been through so much in this country and continue to go through so much. And for us to bounce back every time is, I think, a testament to just who we are as people.
I think being Black has, as you said, it's more than a color. I always say it's an adjective, it's an adverb, it's a noun, it's an action word, it's a color, because there's so many connotations to the word, and there's so much history attached to the word. So I think when I often hear people say, Black, or think about as a child, the first time you heard the word Black, how it, was it a negative experience? Was it a positive experience? How did you perceive it?
I love the Black experience in church. And so for me, it's just a total experience. It never stops. It's always going. And so I enjoy the Blackness of things that we engage in, whether it's art or whatever. So for me, it's just a total experience. I don't kind of have a beginning or end for it. It's just, it happens all the time.
Knowing where you go.
I think there's always a level of pressure when you're a person of color, because automatically, I don't care the environment. Although people say, oh, I don't judge you by your skin color, who you are. When you make that statement, you're already judged. So I think there is an unspoken pressure for people of color that you have to be better.
Yeah.
I do feel pressure. I feel a lot of pressure. Oftentimes in spaces, not just being, and speaking about Black not being a monolith, like I'm queer as well. And so I'm holding an expectation of folks that either look like me or in spaces like me to see what, I always feel this pressure of wanting what success should look like, right? And for better or for worse, right? And to course correct specific communities that I'm a part of, to say, this is how you're showing up. This is what people think about you already. And if you show up in that way, then it's hard for you to get to that next level. And so I do feel pressure of how to also break down barriers of, some corporate cultures that were built off white supremacist nature, right?
Right.
Yeah.
Right. You know, I agree with that. Being able to show up as your authentic self. You know, I think leadership is sacrifice for sure, what Andre said. And then sometimes we tend to shed pieces of ourselves to fit into what the expectation is of other races. And so leadership for me, though, is about service. I consider myself to be a servant leader. And so I always want to make people feel empowered and that I'm serving them in some level or some type of way. But I completely agree with you with when you walk into a room and what the expectation is of you when you walk into that room. There have been a lot of times that I've shown up in certain spaces and they didn't expect the CEO to be me. And so then I'm like, okay. Psych on you. So, you know, so, yeah. And so, you know, but and it's been awkward moments like that, you know, and where I've been with white counterparts and they're like, oh, you know, as if they're shocked. And so for me, leadership is a lot of different things all at the same time.
I agree. One that stands out is being an example. Not just for those who report to you, but outside of the workplace. How am I presenting to this young Black girl who may want to be in this position when she's older? So just always, you know, setting the tone for what you can do when you get, you know, of age. So just being an example.
And to add to that, because so many of those positions are so few.
Right.
So you do feel that pressure like, okay, I got to this role. I can't mess it up because
that is true.
There's a lot riding on my success for the next person to come in and be successful as well.
Absolutely.
I do think the context of leadership and Black leadership specifically changes given the world we are in, because what it means to be a Black leader in 2025 and what it means to be a Black leader in 2020 or 2016 or 2008 are all very different shades of leadership and very different shades of pressure. So I think social context matters a lot, but we've also talked a lot about leadership with a capital L, and you talked a little bit about leadership with a lowercase l, and that's the idea that we can all be leaders no matter our title, our position, or where we are. And I think when we talk about leadership, we focus on the capital L. And when we get to those leaders who have potential, they sometimes struggle to make that next step because they haven't been given the opportunity to believe that they are leaders and or don't know how to successfully transition from being lowercase l leader to capital L leader. And there are real challenges between those two levels.
You aren't leading for yourself. You're leading for those you lead and for whatever organization you are in leadership at. Yeah. Leadership is hard. Mine was going to be building off something Latrice said, because I actually think this is a thing of how we show up in the workplace. You mentioned that when you walk into the room in different spaces and you're saying, I'm the CEO, and someone they're not expecting a Black woman to say that, particularly in the spaces that throughout your career, the spaces you've been in, and it also brings up something you said around resilience. And I think being a Black leader, particularly how I show up in the workplace, when I hear folks go through certain issues, when they bring certain problems, knowing what we've experienced and how resilient we've had to be in certain spaces, for me, it's like, okay, I can coach you through how to get through a situation. And I think there's a little bit more grace when we are us as Black leaders. There's a little bit more grace given to not just Black folk in general, just your staff. Because we've been the person before that no one took a chance on. We walk into spaces that no one believes that we should be in, or very surprised that we are in those spaces. So I definitely show up very differently in the workplace on how I lead, with a lot more grace and a bit more discipline, because there's also that factor of like, you're the only person who knows what you can do, and you're the only person that can prove that, and that is the Black experience. That is the Black experience. That is it right there.
Literally, honestly, I've been in spaces where I personally feel like I do have a unique perspective, and when it comes to showing up as a Black woman, but then I've also in that, within those spaces, I also have to be careful how I show up. And so we've always had to kind of shrink ourselves to a certain degree so that we're not, because when I have a strong opinion about something, or if it's what I know or I believe to be the right thing to do, and how I present that message, I have to make sure I'm not angry, labeled as angry,
Right.
in that space. And so so I've throughout my career in the past, I've had to shrink to kind of conform to what's corporately appropriate. And corporately is not a word, but I'm just saying
It is now.
what and so what corporate deems as appropriate. But I love being in this space because I can authentically be me, because we work with a bunch of individuals who are authentically themselves. And so I think that we all have unique perspectives here, and we all have something that's great that we bring to the table, and that works for this. And so this is freeing for me to be in this space and to be able to just be myself. But I think as this, in the generation of which we live now, I think that a lot of Black leaders are showing up authentically themselves now, not really conforming to what was or what used to be.
Because now they're tired.
Yeah, we're tired. We're tired.
I do believe being a Black leader gives you perspective in the workplace, because we tend to innately or otherwise be more in tune with the needs of the community. Whatever the community is, whatever the work is, we tend to be more in need, be it by our social circles, be it because of our previous work experience. And I think bringing those needs into the workplace and making sure that the organization is aware of the needs of the people we're serving is really, really important. And I think ensuring that we use our voices in a way that makes sure that we're bringing those along with us in some form or fashion really does bring different levity and leverage to being a Black leader in the workplace.
I love it. I think relatable. I think that the advantage of being a Black leader is I understand some of the journey, some of the fights, and so I can help talk through, work through. Where if you don't know where I'm coming from, how do you help guide or lead me?
Right.
If you don't know my journey, if you don't know my walk. My son is a student at a HBCU, and prior to that, went to PWI. And the experience that he's gone through over the years of changing from one school to another has changed his life. And he says every time that, Dad, I like where I was, but I absolutely love where I'm going, because I see the vision through my professors. I see the vision through the the president of the school. And because of that, I think that relatability helps lead when you have the heart to give back because of it.
There's an experience that can't be explained. But I think I agree with you both. There's so much culturally. I oftentimes feel like it is our race that is consistently extending the olive branch to everyone else. And I think innately, and I think so much of that is, I don't want to even say culturally, but I would like to say it's passed down trauma. And everybody says that PTSD, post-traumatic slave disorder.
Ooh, okay.
That there has always been that need to be accepted. So I'm going to overly care for you, because that was so much of what our ancestors were charged with doing, that innately it still exists. But I think each of us determine how and at what level you want that to exist.
Wow. Okay, Michelle.
Okay, I got it. I absolutely, the history of this country plays a role of Black people today. I mean, I don't think any of us wouldn't be where we are if it wasn't for our ancestors who made the ultimate sacrifices for us to be here. Yep. You always see those T-shirts that say, "I'm my ancestors' wildest dreams." I mean, because that's exactly who we are. But to make it a little bit more personal, just the history of my family, for me, plays an important role in my life and what keeps me going and wanting to strive to do more and be better. Mm-hmm. My mother and my grandmother and their roles in life. My grandmother was a housekeeper. My mother was in banking, but neither one of them ever made it to the level that I am today. And so for me, it's about making them proud and making my family proud and doing right by that history and the work that they put in for us to be who we are today.
Certainly a real sense of responsibility to at least live up to an inkling of the expectations that, like you said, my parents, grandparents, great-grandparents had, and the sacrifice they made for me to be able to get the education I've had and the opportunities they provided me with. So absolutely, it's much greater than just me in my life.
Absolutely, I agree with that. And also being a first generation college student, I feel like there's a lot riding on how I present to the community as well as how I represent my family.
Right.
So that's always in the back of my mind. Okay, this is what you got to do to show up for your family.
Correct.
Yeah. Right. And on that as well, instead of saying, what are y'all doing and how can we join? Right? Because one thing about the Black community, and we talk about this about your grandmother all the time, everybody's welcomed.
Correct. Yes.
There's not one time I've seen my mom, my grandmother. Hell, I was at your grandmother's house a couple times before.
Exactly. And we didn't even know each other.
Didn't even know, right?
Yeah.
But everyone is invited into the space.
Correct.
We all can level up. Yeah. And that's also, I think, a difference of what our culture brings is this is not a competition. This is let's succeed and excel together.
Right. Because we're all family.
We're all family.
We all family.
No matter what.
Like it doesn't matter. Yep. We're all family. And I think that is such another level of what we bring just in general. Because we gonna be cousins.
Yeah.
Right. And you're not really even related.
No matter what.
It's
my cousin down the street.
Right.
Where do you feel there's a gap in the Black community when it comes to healthcare, and how do you think 26 Health can help fill those gaps?
It goes back to the statement I made of post-traumatic slave disorder. But, I mean, we giggle about it, but the reality is you didn't have the opportunity to say that you were in pain. Medical books to this day talk about our lack of pain that we don't, which is why they experimented on men of color and women of color. The book of OB gynecology, that book was created based on performing surgeries on women of color without anesthesia because it is thought that we don't
without the permission.
And without the permission. But it is thought that we don't experience pain. And I think so much of that you hear, if you think of older generations, is there's nothing wrong with you, just suck it up, walk it off. And we're so taught that you don't go seek care. So I think so much of that gap is one, the education and making people aware that it is okay to seek care.
I'll take this question because I feel like I've lived it. I'm same, just like you. I didn't go to school to be in healthcare either. I actually went to school to be an attorney.
Oh,
crazy how life ends. But I will say, in the time that I've been in this space, I think a lot of it has to do with our past. It's like generational. We have this weird stigma, in our minds that you only go to the doctor if something's wrong, and I think that all of us can relate to having family like they've never been to have a physical, and then they show up and they're stage 4 cancer, or something like that, because we don't think that if it doesn't hurt, then we're not going to worry about it. I'm not gonna bother it.
Hell, even if it does hurt.
Even
It's
if it
not-
does hurt.
It's
Right,
not
no,
killing me.
If it's
Yeah.
not
just
killing
gonna
me, I'm
push
not
through.
going. Yeah, I'm
Correct.
gonna keep going.
Pop some Tylenol. and
Exactly,
you're
and
good.
keep it pushing.
pushing.
Put some salve on it, whatever. But like, that's really like
That's the
literally
thing, though.
the thing,
It's a
right?
thing.
And so I think that the gap is education, and how do we educate people about their health and about their wellness? And it's not just when something's wrong, like
Exactly right.
check when you think everything is okay. It's check still. And so I think that 26 Health has a great opportunity to educate people. Whether it's through their primary care services or sexual health. There's so many people I hear say all the time that people are like, I don't want to know my status. What? Why do you not want to know?
That's crazy.
Yeah,
to
like
know.
that is
You
so
gotta.
scary to me. But I think that that's where more education can be, a contributing
I couldn't agree more.
factor and help.
I think education is absolutely the key and mindset.
Right. Right.
What the Black community, I'm gonna say the thing because I'm with friends. 26 Health also has a service here that I wish my family would have
I know
leaned
where you're
into.
going. Ooh, I know
Mental
where
health.
mental health.
Like,
Yes.
Right.
Yes.
like there's a
Yes.
huge gap of how the Black community talks about mental health because you just got to either pray it away
Yes.
or you got to just figure it out.
Yeah.
Or you're complaining. And we've always been this resilient.
Yes,
We've
exactly.
always done this thing. But when we tackle, as soon as I became an adult, the first thing I did was get a mental health therapist. And it changed the trajectory of how I think. And I come from a family where there are people who are clinically bipolar. And so that is really important for me to check in on that and check myself on how I maneuver through that. But 26 Health offers services beyond, medical health. It is actually it's medical health to be mentally healthy,
Right.
right?
Right.
And even when you're okay,
Right.
Correct.
checking on it, and it's okay to not be okay.
Right.
It is. I think we hear so many times if we complain about being depressed or down, someone say, "Oh well, so and so has it worse than you."
Yeah,
Yeah. Yeah.
yeah.
Okay, but what about me?
How I'm feeling.
Right. Right.
Like-
I'm still struggling.
Yeah, I feel bad for them, but at the
Right.
same time, I'm going through something too. So we have to stop discounting people's thoughts and their
Absolutely.
feelings. If they are brave enough to come to you with a concern or an issue, like hear them out, and
Yeah.
then you offer them the resources like 26 Health or wherever they need to go
Right.
to make sure they get what they need. So yeah, stop discounting people's feelings.
Yes.
No, for me, it's like you said, Latrice, the education and also access. Many Black families, they have day-to-day struggles. So healthcare is not priority for them. I need to
What about
figure out
food,
how to get my food,
electricity?
pay my rent.
Right.
Like
So-
eggs are $12.
Right.
Like literally.
That's
Like,
crazy.
yeah.
So,
So I get it.
my healthcare is at the bottom.
Yeah.
I need to live day to day.
Right.
So having access.
Or those situations where you got a single mom, her health is last. She's going to make sure those
Right.
kids are taken
Right.
care of, as opposed to understanding that if she isn't healthy, the family's doomed anyway. But
That is
the
true.
education and the whole person concept, we've got to really get out here in front of our people.
Yeah.
I have a couple of thoughts. And the first is I'm going to get the statistic wrong, but it's something like 30% of Black men haven't seen a doctor in the past 2 years.
It's probably greater.
Probably. Probably. Unfortunately. And that's a sad reality because we have one life to live. We have one body to do it in. And with any fortune, we'll make it to 70, right? But when we...
too close for me.
I got a few more years before I get there. But we have to take care of ourselves. And it doesn't matter how well you take care of yourself. Something will go wrong. We have to be willing to take the step to get the care when it does. My mother was a nurse her entire life. And I don't ever remember discussing with her how to build a relationship with a healthcare provider. No one taught me how to do that. I just know the doctors that I keep going back to are ones that I feel like listen to me and don't want to just give me a prescription and send me on my way, or they actually want to take the time to understand the root of the issue. And I think it's really important for 26 Health and for those who current and future patients of 26 Health to know that that's who we are and that's what we want to continue to be. The place that listens, the place where you can come and build a relationship and have a conversation with your provider. I went to the doctor just yesterday and it was, how was your weekend? And that was the extent of the conversation. From there, we went right into my test results, right? My blood work, which is great and fine. But if something else had been going on, would I have taken the time to share with him what? Probably not, because I don't feel any sense of connection or kinship, right? And so I think it's really important that we learn how to build relationships with providers so that we can have a conversation. Because there are times new mothers are brilliant at it. A new mother will call the doctor, my baby is fill in the blank. Right. And I wish that more of us would do that when something random is happening with us, instead of going to Dr. Google or taking Benadryl or whatever the case may be, ginger ale, right?
Another study, I read a study in Harvard Business Journal, Harvard Medical Journal, something like that. Black women have a highest rate of miscarriages.
Infant mortality,
the stress, it's hard, and it's also harder for Black families to start families, create families.
Right.
Well, we have adoption services, right?
Right.
You're like there's the community usually doesn't know where to go for things like that.
Right.
True. Like how do you even start that?
Right.
So that's a gap we can fill as an organization as well.
Well, even if I can add to that, because of the new abortion laws, right? And so now you find yourself in a situation where you're not really prepared to have a baby, but you can't, your only option is to have the baby. So our adoption services can help in that way too, because we take in those infants or those.
I did not know that.
We do, the newborns.
New guy here. That's
Yeah.
Oh my gosh,
We
that's
do.
beautiful.
We do, to help transition to another family. We actually have families waiting right now.
There's the softer side too. Because we're so busy working the two jobs or taking care of the kids.
Right.
We don't think about self-care,
Yeah.
which, is hand in hand with mental health too. So
Absolutely.
at the spa,
Absolutely.
we have sometimes that facial or,
Right.
if you get a massage somewhere else, like
Right.
that can
back
make
from
a
the
big
edge.
difference.
Yeah.
Yes.
Even
Yes.
if it's just the time to close your eyes for 15 minutes.
Yes.
Or however long it takes to get a facial, just for me to have my eyes closed and lay there and just not go anywhere and not have to worry about thinking about anything.
Right.
Self-care.
And someone's taking care of you,
Correct.
giving you what you want.
Correct.
Yeah.
Self-care.
Give it up for yourself, Black people. Right.
Right.
Give it up for yourself. Come on, man.